Quite often we see in our OPD patients who come with complaints of blood in urine. Now there could be several causes of blood in urine. If a 20-year-old young lady comes with complaints of blood in urine and she also says she has increased frequency of urination and she has pain while passing urine, when we strongly think of urinary infection, most of our results will go towards proving whether she has the infection or not. We do a urine examination, a culture, maybe an ultrasound, and quite often we'll be right. We'll find that urine does have pustules, does have blood cells, and urine does show some growth of organism, and we treat them with antibiotic, and it usually gets cured accordingly. On the other hand, if let's say we have a 60-year-old gentleman who's been smoking about 10 per day for the past 20-30 years, he says he's passing blood in urine, then we start to worry. We do know that this is a perfect patient who would probably be having a bladder tumor, and our diagnosis would be, our steps of treatment would be to ensure that if he has a tumor, take care of it at its earliest stage, make sure that he goes home comfortably. So in these people, what we do is we get an ultrasound of his abdomen with a full bladder ideally. If required, we do a CT scan. Often the bladder does show a growth, or maybe there could be a tumor which is about 2-3 centimeters or bigger or smaller. And then they say yes, patient has a bladder wall thickening. And then we look for whether a CT scan is required. If it's required, we get a CT scan done. A CT scan might show if the tumor is going outside the bladder, is there anything else, maybe like a kidney stone, or are there any lymph nodes which could be also problematic. And if we think there is a bladder tumor, then what we need to do is we ask them to send the urine for cytology. Cytology is important in one way. Cytology, if malignant cells are seen, cytology basically means the urine is screened for unusual cells, and if we find cells which have are malignant, then it's a very, very strong suggestion of a high-grade malignancy. On the other hand, if a cytology is negative, it doesn't mean that there is no malignancy, it just means that it could be a low-grade tumor. Then what we do is we go ahead and do cystoscopy. Cystoscopy is an examination of the urinary bladder and the urethra, and it can be done under local anesthesia. We could do it under sedation, we could give a complete anesthesia for it. We go in, if we find a tumor, then we can go ahead and remove the tumor at the same sitting. It's called a transurethral resection of bladder tumor. We do it in such a way where we remove a bit of the tumor, and then we also remove the base and send it separately. The entire idea is to know whether the tumor has gone deeper into the bladder or is it just superficial. A superficial bladder tumor usually heals pretty fast, and though the grade of the tumor is important, a superficial tumor is not actually as life-threatening as, let's say, a deeper tumor. A tumor which has penetrated through the wall of the bladder would have had chances of going elsewhere. We call it metastasis. We could go to the lymph nodes, it could go to the bones, it could go to the liver and elsewhere. And there, just resecting of the tumor from within is not going to help. You need to remove the entire bladder in such circumstances. So this is what is important as far as bladder tumors are concerned. Rarely we do come across some patients who have such huge tumors that you could do nothing about it. In those patients, we actually tell them to get a biopsy done, at least the bare minimum biopsy we do it. We confirm that we are indeed dealing with X and Y kind of a tumor. It is important because the grade of the tumor is also established. We know how aggressive the tumor could be. We ask them to go to the oncologist, and the oncologist takes care of it and gives chemotherapy, gets the tumor to become smaller in size, and then maybe we can probably remove the tumor in a much better way. This will at least give him optimum quality of life. That is important.
Appropriate treatment and procedures are being recommended for surgeries with precision and minimal invasive technology. A patient can recover from the surgery in the shortest time with best results and be back on their feet attending daily routine.